Hi, teacher. I'm Risham there, and now I'm gonna read uh from chapter 24 to 34. From chapter 24 to 34. Match the two parts of the sentence. Look at A, B, and C opposite to help you. Uh 1988 saw the UK launch to leave a Ternid. Is letter G is for A AIDS. Chicks Chickenpox or varicella is a common infectious. Letter E is disease of childhood. Rabies has an incubation. Rabies has an incubation. Is letter A period ranging from 4 days to many months. Fourth, patient remained febrile. Is letter H is with peaks of temperature of 39.3 Celsius. We has admitted with a 4-day history of influenza type symptoms of fever with letter B is rigors, malaria, and general malaise. Six, quite a proportion of patients who recover from hepatitis B is letter C is about becoming carriers of the virus. Eight muscles or rubella is bust is letter D, infection during the cataract stage. Cataract stage. Nine is limb disease is caused by transmission. In letter G is of B, Bulgari from animal to man by ayak isotid ticks. Letter 10, PUO stand for letter E, pyrexia and of unknown origin. Complete the case report on the patient in A opposite. Look at opposite to help you. Case 25. On examination, he looked unwell. His pulse rate was 100 minutes. He had a palpable spleen. The combination fever and rigors in a patient who was recently returned from Africa strongly suggests diagnosis of malaria. The incubation period is usually 10 from 20 to 24 days. In this case, the patient admitted he had not been taking prophylaxis regularly. Regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Complete the sentence. Okay, letter A. Letter one, number one is an infection which can be treated successful with antibiotics is curable. Another word for an epidemic is an outbreak. Bacteria is viruses are example of microorganism. Someone whose temperature is normal is a febrile or apyrexial. The common infection with Epstein-Barr virus is known as a glandular fever. Fever. Complete the box now. Affect, affective. Anxiety, anxious. Behavior, behavioral. Dementia, demented. A disturbance, disturbed. Suicide, suicidal. 25.2. Behavioral with syndrome. Eating disorder, major depression, mental retardation, personality with disorder, psychomotor, retardation, sleep, uh, disturbance, substance, abuse. 20. Next, the way a person behaves is his or behavior. Persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with hyena is called senile dementia. A disorder which is not associated with pathological change is functional. An idea which forces a patient to repeat unnecessary action is a compulsion. Next, case 21. A 56 years old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was pacing urine more often. She was eating normally and her rate was steady. The patient has three of the list symptoms: tiredness, fatigue, or loss of interest, planning poorly, or insomnia. Next page, complete the table. Blindness. Blindness, I think, blindness. Consciousness, deafness, dizziness, numbness, lightheadedness, unsteadiness. Next, make the word combination. Double with vision, epileptic, fit, tremolo symptoms in couple con attack, urinary con incontinence, visual con acredy. Next, a doctor is trying to determine the cause of loss of consciousness in a 53 years old man. Okay, complete the doctor's question. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before pass out? Were you worried, wonder any stress at time? Did you feel dizzy or lightheaded before the attack? Did you lose control on your bladder? Did your wife notice any involuntary movement while you were unconscious? 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 Okay, next. Complete the table with four from A to B opposite. Absence. Diminution. Faxity, flaccidity, uh, spastic, waste. A doctor giving instruction next. A doctor is giving instruction to a patient during an examination of the motor system. First one, I would like to relax. I'm just going to move your arm up and down. Is a muscle tone. Can, oh my God. Can I see your hand, muscle buck, and possibly involuntary movement? Now I'm gonna to straighten your arm out. Try to stop me. It's like power. Can you touch my finger with your and then touch your nose? Good. Now do it again with your eyes closed. Coordination. Next, 27.3. Complete the sentence. A flaccid hand droops limply to form a right angle with the wrist. Breaks reflex are reflex that are stronger than normal. Muscle wasting means the muscle is reduced in bulk. A tic is a form of involuntary movement. A key is often used to test to plantar response. His coordination was poor. He couldn't perform rapid alternative movement. A tendon reflex hammer is used to test reflex when something is diminished. No, is diminished. Uh, uh, is less than normal. Esa palabra, dimi, di, dimi, dimi, diminished, diminished, that word is pronounced diminished. A patient is brought to aid in court, okay? Next, complete the table with word from A to B, opposite relate from. Curative, excise, excision, growing, invasion, invasive, obstruction, obstructive, palliative, palpable, spreading, swollen, like participle, like an adjective, swollen. Next, the notes below How about the patient describing the opposite? Use them to sentence okay, correctly. The examination of the central nervous system was normal. Is CNS NEAD? His mouth and throat were normal. Is out of Orthophonics, orthophonics NAD. There was a smooth, firm, 3 per 4 centimeter mass on the right supraclavicular fossa. It's number 3. Nodes diameter probably in both ocular and inguinal rest, level 7. CVS and NADRS NDA4 and add mass palpable 3 centimeter below L costal margin is 5. Complete the sentence. Okay, distance spread of tumor cell is known as metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called a cancer tumor which does invite to metastasize. To metastasize are benign. Secondary tumors are those which result from the spread of a primary. If a cure is not possible, palliative treatment should be given. A palpable liver suggests metastasis. Next, 29.1. Complete the sentence. A baby that is born a week before the ADDD is premature. A termination pregnancy may be necessary for medical reason. The first 3 months of pregnancy are known as the first trimester. Fetal distress in the first stage of the section is an indication of Caesarean section. It was a bridge presentation and the liver was by forceps. Uh, mm, miscarriage is normal term for a spontaneous abortion. The umbilical was wound tightly around the baby's neck. It's unfortunately called stillborn. Above the table, verb and noun. Now, abortion, delivery, induction, miscarriage, present, presentation, termination. Dr. Bernard and SHO is presenting a patient at a weekly meeting of is the obstetric unit for a hospital. This is Clara Davis. She came to the antenatal at 9 week. In her past obstetric history, she had a pregnancy when she was 18, which was terminated, and another one a year later, which spontaneously aborted since. Then she has had 3 pregnancy. In the first, the baby was delivered normally at 40 weeks. In the second, she had an for induction of labor of 39 weeks because of fetal distress. Third baby presented a break and was delivered by cesarean section. Next, 30. Make word combination using a word from each box. Blood stained, breath, resonance, pleural, rub, productive, gulf, vocal is resonance. Rewrite the question using the word that are better known to patient. Is your cough productive? Do you cough up any phlegms? Is it a low cough? What color is the sputum? What color is the phlegm? Is it ever purulent or is it ever yellow? Have you ever had a hemoptysis? Have you noticed any blood in it? Do you suffer from dyspnea? Any problem with your breathing? Next, are the following statement true or false? First one, a patient who has low cough produce phlegm is uh is true. Correct. Crackles are heard when the airways are narrowed. False. A patient who has a non-productive cough produce sputum. Fourth, wheeze are typical in pleurisy. False. A pleural rib in a sign of asthma. False. Well, the sun here when the pleural surface are inflamed and pleurisy is called a pleural rub. A productive cough, if often described as lows, a cough maybe productive where the patient coughs sputum or phlegm. Crackle suggests the presence of fluid in the lungs. A cough may be unproductive where there is indicate narrowing of the airways. The sound of an asthma patient breathing is also called wheeze. The sound here when exactly. Okay. Next page. Complete the description of Elb's zoster or shingle by replacing the medical word in brachial breaks with ordinary English word. Shingle, herpes zoster usually start with pain and soreness, then red spots, macule, appear and develop into group to small blister over a particular area on one side of the body. In most patients, new spores of blister continue to appear for 3 or 5 days. The small blister vesicle become filled with pus and then form scabs. Its severe causes, there may be scares afterwards. Read read the description of the rash of rubella and complete the notes. The spots are scattered pink macules with appear first behind the ears and on the forehead. The rash spread rapidly first on the trunk and then to the limb. Location and distribution. First behind the ends, ears and on the forehead, then the trunk and limbs. Groping is scattered. Type of lesion is macules, color pink. Complete the nose of the rash in the photograph and suggest the diagnosis. Okay, location and distribution is located in on the chest and abdomen. Groping is scattered. Type of lesion is small macules with some scales, no scale, scales. Color pink. Okay. Complete the notes for the lesion in the photograph and suggest the diagnosis. Location and distribution is below lateral angle of the left eyes. Grouping is single. Type of lesion is nodule. Color right, pink basal cell carcinoma. Carcinoma. Next, write the corresponding medical terms of the ordinary English word. Common word, medical term, type of force. Bruise is conclusion, blunt. Could insist, sharp. Graze, abrasion, blunt. Scratch, abrasion, blunt. Stab, wound, penetrating round, penetrating round, uh, penetrating, wound, sharp. Tear, laceration, blunt. Choose the correct word to complete the description of the if the injury is shown in the illustration. There are grays above the left ear is brown on the left side of the neck, contusion of the left side of the lower limb, tears to the left cheek. Right description of the injury shown in the illustration. So there is a laceration tear of the left shoulder. This is my left shoulder. Uh, and and incised wound, acute uh, approximately 6 centimeters in length above the left nipples. Completing the sentence. Frequent change of position are necessary in the mobile patient to prevent the development of a pressure sore. He had several stab or penetrating wound in the abdomen from the knife. He was knocked unconscious by a heavy punch of the head. The wounds were only superficial and required no treatment. Next, look at the conversation A opposite to help you to note about Mr. Jones. Use medical terms where possible. Frequency in nocturia for 1 year. No dysuria or hesitancy. I don't remember. Stream is hesitancy. Oh, no, I think it's hesitancy. Stream flow a little weaker. No incontinence apart from occasional curdling. Match the patient description under a symptom. I have to pee every half hour or so is B, the frequency. I get a scalding pain when I pass water is dysuria. I have to get up several times to pass water at night is nocturia. I have to rush to go to the toilet is urgency. I have trouble getting started is about hesitancy. I can hold my water is about incontinence. I pass some blood in my urine. It's about hematuria. Write the doctor question of each symptoms. Answer below. Describe the finding of the laboratory report in word. Blood plus protein cast. There was a trace of blood growth, protein or proteinuria and no cast. The question, okay, is frequency. How often is that? How often do you pass urine? In dysuria, do you get any warning on pain when you pass water? Dysuria, do you have to get up at night? Hesitancy. Hesitancy, do you have any trouble getting started? Incontinence, do you ever lose control in your bladder? Hematuria, have you ever passed blood in the urine? Urgency, do you have to rush or hurry to get to the toilet in time? Last one is a doctor is talking to a patient during the ophthalmoscopy. Okay, I'm gonna match the underlying expression she used. Right, Mr. Gold, because you have been having this headache, I'm gonna to have look at your eyes, particularly the back of your eyes, the retina. I'm gonna pat a couple of drops in your eyes, which will make it easier for me to see the retina. After a few minutes, you may find the vision a bit blurry, and this will wear off after about an hour. I need to get rid of as much external light as possible. This meaning closing the blinds. Now, I would like you to look straight ahead uh, at that clock. Please take a few minutes and your eyes might feel a bit tired, so you can blink if you need. I don't want to look at me, look at the clock. The examination is done with dim light 3, a topical hydritic solution 1 to aid dilatation through fixate on a target 4. Complete the instruction. Wrap the wrap the cuff around the patient upper arm. Place the diaphragm over the area in brachial artery. With the patient arm to the brachial artery in the same aid as the arm. Close the valves in the pump for pump up the pressure at least 150 mmHg. Open the valves a little and slowly deflate to go while listening and watching the pressure gauge. The first sound you hear in the flow of blood flow, the brachial artery, the valve with the gauge, the point of the systolic blood pressure. Continue listening while slowly deflate the cuff. The diastolic blood pressure is measured when the sound completely disappears. Complete the text, look at scene opposite to help you. A phlebotomic are specially trained in taking blood. Their skills are vein puncturing the vein to take a blood sample. The risk and then foot can be used, but more often a vein in the inner or the elbow is used. If difficult to locate a suitable vein, the patient may be asked to make a first or tourniquet, maybe applied on upper arm to make the vein more apparent. Afterward, dressing is applied to the patient are to press gently. This helps to stop the bleeding and prevent bruising at the site. Uh, it's important that specimen tubes are labeled correctly before they are sent to hematology laboratory where a full blood count or over investigation will be carried out. Carried out. Thank you for watching. It's all.